I'm Charlene Zamora, and today I'm going to present the case study for the class 2924B. We're going to go for a brief overview of the degenerative sacroiliac joints, mild sclerosis, joint space narrowing, and asymmetric sclerosis superior left SI joints. Brief overview of degenerative sacroiliac joints, joint space narrowing, mild sclerosis, asymmetric sclerosis SI joints. Sclerosis is a disease characterized by hardening of the tissues and can occur in any part of the body. The cause of the stiffening of these tissues are because the replacement of the normal organ tissue with the connective tissue. The structure may have to undergo two sclerotic changes and display the sclerotic lesions. Degenerative sacroiliac joints can occur for different reasons. It could be by traumatic injuries, infections, arthritis, even pregnancy. The narrowing of the joints can occur for different situations. Could be by overuse, just by aging, or maybe a tearing over time. In many cases, are treatments as injections of cortisone, or if the case is very severe, they will end in surgery and replacement of the joint. Here you can visualize the radiology report that South Florida Diagnostic Images was very kind to let us have a copy of to do this project. The note says the patient present changes on their degenerative changes on the sacroiliac joints. They have asymmetry of sclerosis and narrowing of the joint spaces. On conclusion, is suggesting the patient to have a further checkup by the doctor to prescribe an MRI and maybe a bone marrow study. The patient is a female, 46 years old. Her main complaint is pain in her lower back, especially when she's sitting down for a long time or she does physical activity. The pain was for over 3 months. The routine to visualize the sacrum coccyx area is epiaxial sacrum, epiaxial coccyx, and lateral. This is with the purpose to rule out any pathology or fracture of the area. On this image, we visualize the epiaxial sacrum projection. This is only the labeling image where you can see how the sacrum is looking. It looks elongated because they have a 15 degrees cephalic angulation, and the coccyx is not visible. The purpose of this image is to see the sacrum without any superimposition of the symphysis pubis. If we follow the arrow, we're going to visualize the base of the sacrum. Then we have the sacroiliac joint on the right and the sacroiliac joint on the left. We have the sacral body at the center right here, the ilium, the pelvic rim, the symphysis pubis, the ischial spine, This is the aula, and the pelvic rim. This part right here is not labeled, but this is where the acetabulum is at. This is the actual image of my patient. This is the epiaxial sacrum. The central ray is 2 inches above the symphysis pubis, and the angle was 15 degrees cephalic. The technique I used was 92 kVp and 8 MAS. You should see always the intervertebral joint spaces, the SI joints, the L5S1, and the sacrum must be free of superimposition. You can visualize the left sacroiliac joint, how it's narrower for the superior area if you compare with the right side. Something important to consider when you have this type of images is to ask your patient if you want to stop by the restroom before we start the procedure, because when they have an empty bladder, you can visualize the coccyx better, and also it's recommended to have the lower colon free of gas and fecal material, and require a cleaning enema. It's recommended, it's not like mandatory, but it will improve the image, of course. You will see on the next slide what I mean. This image, I believe that I could be improved if I will be coordinated more to have a better detail of the coccyx. The central ray for this image is 2 inches above the symphysis pubis, and you angle the tube 10 degrees caudal with suspended respiration to avoid motion. The coccyx must show free of superimposition. That's the purpose of the angulation. The technique, it was 92 kVp and 8 MAS. I consider that this image could be taken in a better, and in this area at the center, this is a gas in the area of interest. I believe this image is a little bit underexposed, and it has a lack of detail because it could be the AAC, it was malfunctioning, or the MAS was too low. What I will do to fix this image, I will move the central ray a little bit more to the right side of the patient to center it properly, and it will change the technique by increasing the MAS. This is the lateral sacral projection. You must see the L5S1 disc space. The whole sacrum laterally should be in the image, and also the coccyx. This is the lateral sacrum coccyx of the actual original patient, and you can see that it is not fully through lateral, because if you see the L5 and the distal part of the L4, how you can see they have a little bit of rotation. And also you can see on the femoral head, you have both of them, one is higher than the other one. but the greater sciatic notch, it should be superimposed the left and the right. It's just a minimum rotation, but it's there. For the future images, what I will do is center the patient better, open up longwise a little bit the collimation, and fix the rotation. Thank you for watching this video.